So many of my patients come to me and say, am I too old for joint replacement? That has changed drastically as well. And so what we see is with modern anesthesia techniques, with modern surgical techniques, with better tools, and I joke because my dad's a doctor, that with better surgeons, these surgeries are becoming safer in patients who are more grown up. So if we look now, because we don't have to do general anesthesia, because we don't lose as much blood, because we do the surgery much faster because of better tools and teams and all of that, this is becoming a safer surgery for patients who are in their 80s and even 90s. Next week, I have a patient who is having a knee replacement with me on his 93rd birthday. The most grown-up elective surgery, or the person who is the oldest that I've done an elective surgery on, is in their late 90s. And so we've seen a very large change in the safety of this surgery, allowing us to do it on patients who are more grown up. You know, another consideration for can you be too old to have a hip replacement is we must consider the difference between physiologic age and chronologic age. We've all heard the joke that age is nothing but a number, and that actually is true. We're starting to see that there's some 90-year-olds who look like 70-year-olds, and there's some 60-year-olds who look like 85-year-olds. And that's not anything to say against that patient, but it's to say that there are some patients who are on the younger end of things that have comorbidities that do make them not as safe for surgery. So in terms of working our patients up for surgery, we want to make sure they're safe for surgery. While chronologic age does play a little bit of a role in my decision, I use your medical doctor's interpretation of your health to decide if you're safe for surgery. We have now many different validated scores that we may use to plug in your specifics to determine if you're safe for surgery. And most of that has to do with your overall health and less so on your age anymore.